With more states and counties expanding COVID-19 vaccine access to different groups of people, some Californians are starting to feel left behind. To date, the state has administered more than 15 million doses of COVID-19 vaccine. Current eligible groups include adults 65 and older, healthcare workers, educators, people who are incarcerated or living in homeless shelters, essential workers such as those in the food industry or emergency services, public transit workers and janitors, and residents 16 and older who have disabilities or underlying health conditions. But for people who do not yet qualify for a vaccine in their area, there are limited options for obtaining a coveted dose. There have been cases of people buying their way into shots, stealing access codes or self-attesting to having an eligible condition they may not have. Officials have decried line jumping. But there are other ways. Earlier this month, the state launched a volunteer page on its MyTurn website that enables Californians to assist with vaccination efforts in exchange for a chance at a shot. And you don't have to be a doctor or nurse to take part in the program. Non-medical volunteers can sign up to assist with vaccine registration and administration support or as a site greeter. Volunteers who complete a shift of 4 or more hours are eligible for a vaccine, although shots are not guaranteed and are contingent on supply levels at county-run or city-run sites. It's worth noting that some Angelenos have reported long waiting lists for the program. Another option is to seek out standby lists for leftover doses, which could go to waste if not administered within a certain time frame. Websites like Dr. B are matching people to local providers, who notify them via text message when they have unused supply at the end of the day. Unused doses can become available when people cancel or fail to show up for their appointments. Similarly, many people are calling local pharmacies or checking in with vaccination clinics at the end of each day to try their luck. While jumping the line can take a critical dose away from someone who urgently needs it, medical ethicists have generally agreed that it's better for a shot to go into someone's arm instead of into the trash. Fontana resident Marla White, 57, said Wednesday she planned to start visiting a local vaccination site around closing time after 2 of her friends were able to secure doses that way last week. It took them 3 tries, but they got their shots. White said she would be going, every night until it happens, with her fingers crossed. She also has been on the volunteer waiting list since last month. Some pharmacies and providers are even issuing official policies about leftover doses.